Okay, thank you, and good afternoon, everyone. Thank you for accepting to come for assisting us in this press conference so that we can educate our community in terms of medication management at home as well as in hospital. So, as Nikira has said earlier, this week is a Medication Safety Week 2021, and we have, as usual, organized this activity in terms of to reach out to our community. So this week we are going to have several activities, starting from today. As you will see, there is this bag that the hospital senior management team has accepted to buy 500 bags Medpack, which we're going to be distributing to the community for those patients that are qualified according to some criteria that we have set. First of all, going to be part of these our high-risk patients who are dialysis patients, all of them here as well as in the Grand Turk. In second place, the oncology patient that we have in an oncology clinic, as well will be the second group of patients that are qualified for that. Then it will be distributed between our internal medicine patient and the pediatric patient who are getting polypharmacy. When we say polypharmacy, is those patients who, due to their chronic illnesses, they're taking 4 medication or more. So medication reconciliation has been instituted from this hospital open, is a process in which we have it on a regular basis, trying to improve the services. What is the objective of it? The objective of it is to, in each visit that the patient come to us, either to see a nurse or to see a doctor, actually even including to the pharmacy, the community pharmacies, patient, we encourage them to take their medication, because studies has shown for several years all over the world that medication-related error are one of the main cause of adverse medication events, which could sometimes be fatal. So that's why we encourage all our patients, every time they go into any healthcare facility, it can be here in the hospital or private doctors or at the Ministry of Health clinic. If you are taking any medication, take it with you. Why we're saying that? Because sometimes you are taking some medication, and when you come to see the doctor, he can prescribe another medication, which they could have interaction. So if the doctor don't see what you are taking, it will be difficult to know if this medication will have interaction with the other. One can increase the side effect of the other, or the other can inhibit the activity of the other. So you could have such a, as well, we can check the dosing, because you can have the same medication, but the dosing can be different. So it happens sometimes the doctor prescribes you a medication of a dose. When you go to the pharmacy, they don't have the same dose of that medication. They say that they prescribe a medication 10 milligrams to be taken twice daily, but when you go to the pharmacy, they have only 5 milligrams. So the pharmacy will, it will dispense you the amount that you're supposed to be taking, but you don't know that that tablet has only 5 milligrams, while what the doctor asking you to take is 10 milligrams twice daily, and it could be the other way around. Okay, so there's a lot of events that can be related to medication error. So that's why now our objective now with these bags that we're distributing to our clients is, one, to ensure that it facilitates to our clients that every time they're going to move, they move with their medication, so that we will be able to reconcile them. Okay. As well, we expect in this project that we're going to be evaluating in over a year, in 3 months, 6 months, and 1 year, to see what is the outcome of those patients that have been involved in this project, to see if we have a better control of those patients will have better control of the medical condition if it's high blood pressure, sugar, cholesterol, and so on. So over the time we can say that, okay, this really has helped, because the non-compliance of taking medication is high in our community. And this is not something which is just specific for our community. This is all over the world. But when you come to the doctor and the doctor realizes that you bring your medication, you are not taking them, then we know that this is a patient who need education. We can explain to them, the nurse can explain to them, this is no, you need to be taking your medication, okay? So this is one of the objectives. And ensuring that the patient is compliant with their taking their medication, you will have less admission to hospital, less visits to emergency department, because you are compliant with medication. So in general, your health will be better. And that is our objective. Ensure that you keep yourself safe and with good health. Thank you.
You see, discrepancies in medication information at different sites of care is rather common. What we find is that a patient might have gone to a private practitioner and gotten a list of medications prescribed. They may have gone to the emergency room and gotten a different list of medication prescribed, and they are now in the clinic. And from moving from one place to the other, they end up with a large set of medications, and sometimes can be confused as it regards to what should they really be taking. What we find is that the patients who are most vulnerable are those who are of an older age and are taking multiple medications. So the process of medication reconciliation assists us to ensure that medication errors are aborted or prevented. So what we do as physicians, as nurses, as clinicians, we encourage the patients as much as possible, if they can, to bring their medications to the consultation. If they, for some reason, can't bring the medication to the consultation, we probably may phone home, or we may phone the pharmacy, and to get as comprehensive a list as possible regarding the medications they are taking at home. And this would include their over-the-counter medications, their supplements, their herbal medications. We look at all the medications that they're taking at home, compare them with what we intend to prescribe or has prescribed, to determine if there is any potential for drug-drug interaction, determine if there is any likelihood that the patient may be doubling up on a dose that was not intended, if they're omitting doses, etc. So that's the whole essence of medication reconciliation. By doing this reconciling process with the patient for the few minutes they're in the consultation, we can avert potential harmful medication errors occurring. And to us, that means a lot.
The Turks and Caicos Islands Hospital is a diamond accredited facility with Accreditation Canada International. A part of our accreditation program and patient safety targets, we have adopted the medication reconciliation program. And when we say reconciliation, it is really looking at the medications that you are on and trying to come up with a most accurate list of medications, comparing those medications to what your new orders may be when you visit the hospital. And we try to do this throughout the continuum of care. Everywhere you go in the hospital, every touch point that you access, that you come into contact with a healthcare provider, you are able to give that provider the list of medications most up to date that you are taking at the time. This is very important for patient safety, as it helps us to guide the overall plan for your care in terms of whether those medications are still accurate, are still up to date, are still warranted, or needed, or if we have to make a change in your medication plan based on your disease or condition at the time. And this was explained by our colleagues. Why this is a global patient safety target? Because we have recognized that errors do occur with medication administration and medication application, and the world has come together to make this patient safety intervention throughout all healthcare facilities so that we are able to provide a safe environment when it comes to taking medication. Medication reconciliation is a patient safety goal that has been initiated by the Joint Commission, most accreditation bodies. Since 2005, it is one of the national patient safety goals, and it also forms a target for international healthcare improvement. That organization has medication reconciliation as part of their 100,000 Lives campaign, where we are seeing interventions, patient safety intervention of medication reconciliation can prevent errors or adverse events. And we definitely here at the Turks and Caicos Islands Hospital continue to build on our strategy for patient safety and keeping persons safe. Medication reconciliation is by no doubt one of our patient safety targets that we continue to drive here at the Turks and Caicos Islands Hospital, and we partner with our communities and patients for patient engagement and patient safety.
Pharmacists play a key role in medication reconciliation processes, such as when patients are admitted to or discharged from a hospital. Through performing medication reconciliations, pharmacists can identify and resolve medication-related issues to reduce the number of medication errors, prevent potential adverse drug events, and improve patient safety. For those who are not familiar with the term adverse drug event, this is defined as any injury or harm resulting from the use of a medication. When performing a medication reconciliation from a pharmacist's perspective in the inpatient setting, we obtain a list of medications that the patient takes at home firstly from the patient directly, because as we all know, patients do not take their medications as prescribed. Secondly, we contact the patient's local pharmacy, as this would give an idea of any additional medicines that the patient may be taking. For example, any over-the-counter medications or any other medicines prescribed by an external prescriber. All of the medications is then, once received, is compiled and compared with the inpatient and discharge medication list for that patient. By doing this, it helps to ensure that patients are on optimal therapy based on their most up-to-date conditions and to prevent the potential for adverse drug events. Some of the medication errors resolved by hospital pharmacists include restarting a medication that was missed off by mistake, removing duplicate medications, adjusting incorrect doses or quantities. Community pharmacists' involvement in medication reconciliation after discharge is also important, as it can help reduce readmission rates. It is an effective way of preventing errors in the patient's medication history being compounded after a hospital visit. When the patient is discharged from the hospital, they are usually given a prescription. The patient then takes this prescription to the community pharmacy, where the pharmacist would compare the new prescription with the existing prescription on the patient's medication record. The patient's medication record would be updated to reflect these changes. This process also ensures that the private clinics and the other community pharmacies can receive the most accurate and up-to-date medication history if the need arises. The Turks and Caicos Islands is a great example of a healthcare system where the hospital, community pharmacies, and private clinics are independent and also have independent systems. This creates the possibility for gaps in medication history and inappropriate or duplicated medicines to occur. That is why this initiative is a great one, as it will help to close those gaps, and is a good decision to always use the same pharmacy.
As I said earlier, the first group of patients to receive these bags will be the dialysis patient. Those in Providenciales as well as in Grand Turk. So now, at this moment, we are compiling the list of these patients. So this week, the distribution will start to this group of patients. We have already gathered all the oncology patient. More likely soon, like today in the afternoon or tomorrow morning, we will start distribution with the oncology patients. So the other group of patients is those are, as I said earlier, in internal medicine, family practice, and the pediatric clinic, where we will be screening those patients, looking at those essentially who have chronic medical condition and on polypharmacy. When we talk about polypharmacy, will be only those with having taken 4 medication or more, and on daily basis. So these are the major group of patients that we're going to target. We will, of course, going to be taking some information, names, telephone number of the patient, just to make sure as well. We have to get the consent, at least verbal, from the patient that will be willing to be involved in the project before we hand them the bag. And this, once it started, it's going to have a continuous evaluation. So at 3 months of starting the program, of receiving the bag, we will evaluate the patient, to asking them to see if they have been coming to the clinic to see the doctors or going to see their physician or pharmacy, if they are taking their medication in the bag. So the second thing will be evaluating their clinical parameters as well. It's not we're going to do it just because of the purpose of the project, but because this is something that normally the doctors will do. They will check their blood tests, they will check their blood pressure, if they have blood pressure, their blood sugar, and so on, to see if there is any improvement. And as well, we will be asking the patient to see if they realize that they're having less emergency visits once they started taking, receive the bag and being compliant with their medication. As well, important, we'll ask them if themselves they realize if that help them to be more compliant with their medication. So that is how we outline the project. And we expect by the end of the year, in 1 year period, to see a significant clinical improvement in their health and health parameters, control of more blood pressure, if they're asthmatic, less asthma attack, if they're diabetic, less sugar problem, or their HbA1c is more better than how it was before the program started.
Okay, perfect. And I'm of the assumption that we don't have any questions, so I think it covered all the bases. Thank you guys so much. Be sure to capture some close-ups of the actual